Welcome. This is the very first episode of the Ambitious Writers Podcast. Yeah.
Yay! I was like, this is good. This is great.
I'm really excited for this. This is awesome. I've been wanting to do this for a while. I'll make this a short and sweet introduction. So I've been wanting to interview first responders, medical professionals, and entrepreneurs for a really long time. And just get to know their story and, get to know them.
Well, thank you for having me as your first
Well, thank you for being the first guest.
Absolutely.
So, yes, I have my very first guest. Mari.
Hello, guys.
Go ahead.
I am
Introduce
Marisa.
yourself.
I have been a medical assistant for 4 years. I am now an administrator at a rehab center, essentially. We are in a substance abuse clinic. But my days as a medical assistant, I hope, are very long gone. But the days that I did have were very great and crazy. Yeah, dude. I mean, I think from the very beginning, I never thought I would be where I am today in the sense. And the way I got into medical care, I think the healthcare, I think is kind of funny because I was living in Grand Junction and was going to school, just kind of doing, I went to CCP for 2 years actually first and was going for criminology, criminal justice to begin with. Hated it, didn't like it, did my second year literally just doing still the, what are they called? Not electives, but...
The general education.
Yes, yeah.
Gen Eds?
Yeah. And just kept doing those, wasting money, accruing debt. And so I moved to Grand Junction and kind of essentially still did the same thing. I just thought a different location was going to help me explore more and kind of figure out who I was. And so I was like, okay, I need to start making money because I was a bartender / server at the time. And so I was like, I need to start making money and have like be on my own healthcare insurance and stuff like that now. You know what I mean? Like start figuring out my life. I was 21 or 22 at the time.
Okay.
And, I'm 25 now and went to Intelitech. That was just a 9-month program. Started in Grand Junction, ended up moving back to Pueblo, finished it in Pueblo. I did my externship where I actually started my first job, but I did it in family medicine essentially. And that told me everything that I wanted to know. Like I just did it because I wasn't going to go to nursing school and ended up hating the job. I'm sure the pay is great. Absolutely. I have plenty of friends that are nurses. The pay is freaking great. Yes.
Yep.
But I don't know, I didn't want to waste 4 years of my life on something that I didn't know if I was going to do or not. And I'd rather find out in 9 months and kind of go from there. And I could go to nursing school after that. You know what I mean? Like that's nothing.
I feel you.
And so I did it. I hated peds. I just can't do kids. And it was not even essentially the babies. It was more of like the 8 through 14, like giving them their immunizations and everything like that. Oh my gosh, the horror story. It was my fucking second or third week there doing my student externship. And I had to give, I want to say he was 9 or 12. And I had to just give him I think it was like a tetanus shot and something else. And super tetanus, only half a mil. And the other shot, I believe, was probably, I think, even lower than that. And so I was just trying to just in and out. Like, those are easier than giving them, like, a full gram of something, you know what I mean? And so I literally went in there with him. As soon as he's seen needles, freaked out. Jumps behind the table, hides literally under it because it was in a corner, so he, like, jumped over the head of it and just, like, tucked himself underneath, like, his mom couldn't even reach him. And she was like, nice. I'm gonna call your dad. Okay. And then, boom. Gets in a chair and he's like, I'm not doing this without the cold spray to like pretty much try to numb it. And I'm like, this is going to be such a long day. And I was even having like a long morning and everything at that. And I think it was like 1 o'clock by the time.
Interesting. That's awesome.
Yeah, no.
Wow. Yeah. Well, that
family
was
medicine, not for me.
That was a great introduction.
Sorry. I just jumped into it.
That's perfect. Yeah. I have some questions and I just wanted to go down, but that was like, that was awesome. Thank you. So how old are you now?
I'm 25.
25? Okay. How long have you been in, like, healthcare?
Yeah, since I was 20, 21, just kind of starting it all with the MA stuff. And after I did my student externship in the family medicine, I started the urgent care that January of 2019. And I stood there until August of this year.
Really?
Mm-hmm. I was there.
This year?
Mm-hmm.
Here in Pueblo?
Yeah.
Wow.
At the same clinic.
Okay, so you went to school in Grand Junction before you did all this, or
yeah, I went.
Did you
in Mesa? Yeah.
Okay.
And then
what year was that?
2017.
2017.
Mm-hmm.
How long were you in Grand Junction for?
I want to say fall 2016 or fall 27, summer 2016, summer 2017, one of the two.
Okay.
Came back fall of 2018 and then finished at Intelitech in Pueblo and did my student externship that winter and started the job at the urgent care January of 2019.
Okay.
So it all just kind of happened pretty quick. Yeah.
Okay. Wow. Well, for the people that don't know, I got to introduce myself. That was a long introduction for her. Yeah, so my name is Xander. I'm an EMT. I work at a clinic right now. I was a wildland firefighter out in Oregon. It was really fun. I loved that, but it wasn't like medicine, so I wanted to do something with medicine. Also, as well as like my main career choice is firefighting. So the fire service is something I've always wanted to do for the longest time, and it's just a calling, and I want to do it.
How was it in Oregon? Like, what did you do? Were you doing? Is that the firefighters that do like the purposeful fires? And then or are they just there to put it out? Like how I don't know if it's like the park rangers when you go and you set certain land on fire. Okay. Similar.
So we work with like park rangers and the Forest Service and different like federal agencies and local agencies. We were a private agency, private contractor, so we didn't work for like the government or any other. I guess it was like a local contracting crew. They have one in Montana, but it's mainly in Oregon. But yeah, I mean, yeah.
Is that what you did in Oregon?
Okay, hold on. I got lost.
Are you getting lost in your own Oregon story?
I got lost in the whole Oregon story. Okay, yeah. So yeah, we were a private organization. So yeah, we just did wildland. They started doing prescribed burns as soon as I left. I left September 30th because I just wanted to go home. I should have stayed out longer. Honestly, I was thinking. I've always like thought about that, and I've reflected on it like a lot. So I was like. But it's okay. But yeah, so they do prescribed burns. They do probably I don't know. I don't know. But yeah, they do prescribed burns. They do forest mitigation. So you go out into the forest and like cut down trees and limb up trees, and then that's how they prepare for burning the piles. And I guess I don't know. I worked with a guy who was really biased about the whole I don't know, burning tree. He was just really biased. He's a good guy, but he was really biased.
What was he saying?
It was like, is burning trees really good, or is it like bad for the? He just had his bias opinions.
So that's my question. So what's the point of it? I don't.
I'm not too sure. So the whole point of it is to mitigate like a worse wildfire, I guess, in the future. So. There's different ways of doing it. This crew, they went in there with chainsaws and cut down, trees that were already cut down. They went and limbed them up and then put them in piles, and then did like hard work that way. Like it was a hard working job. Well, there's other crews and other agencies that do it differently. That have like machines that go in there and do it for them, and like logging companies too. Like you have all these machines, like newer. Modern ways to do this kind of job, but I guess this job was different because it comes with like a different mentality in a sense, and it's like in a way we gotta like doing that, so we don't really care for the machines. We're just kind of doing our own thing. Everybody has their own part in what we do. So
did you save a cat from a tree?
No, I didn't do that, but that'd be pretty cool. But yeah, they do prescribed burns. We prepare for those by doing that, by cutting up the trees, putting them in piles, doing all that stuff. We were really just fire crews. So when there was a fire, you know, we got a call, and they're like, all right, well, that's priority over this. But when we weren't on a fire, that's what we did. So, but it was fun. I enjoyed it. It was a lot of suck, a lot of hard work for sure. Like a lot of hard work. It was hard work. It wasn't like it suck in a good way. Like
how long were the days?
Like 12 to like 16.
Oh my goodness.
They can be longer though.
Yeah.
Like there's other crews that are out there that just cowboy it and
wow.
Yeah, do their own. It's crazy. Yeah, this job's wild. It's wild. I love it though because you meet all these different crazy folks and it's like oh shit, you know.
So what's it like doing that versus being an EMT?
Now? Oh, it's a totally different ball game. Different ball game. This is like strictly wildland and working in the wilderness. I mean, there's opportunity for medicine, but this is more like municipal and city-based medicine. So it's like it's different. They're two different environments. This one's more like constant dynamic. The other one's like you're gonna see people like maybe get something on their eye, or you're rarely gonna see anything that's bad. So it's super different. It's strictly fire, and then this one like strictly medicine. So but it's cool. That's why I like them. Yeah. So I want to do like structure. That's what I want to do. But I like the wildland ball game too because it's just strictly cowboy.
Yeah.
So I kind of like that lifestyle.
Yeah.
But yeah, little rundown about me right there. Yeah.
Love it.
Anyways, yeah. Okay. So where are you from? You from Pueblo?
Yeah, born and raised. I went to South for high school.
Okay, sweet. South?
Mm-hmm.
Nice. What year did you graduate?
15.
Really? 15. Shout out. Do you guys have like reunions at all?
Dude, I don't know. Our 10-year is coming up in 3 years. Actually, me and one of my coworkers were talking about that today, and I'm like, my 10-year high school reunion is coming up in 3 years. Like, to even say that sounds so crazy to me. Yeah, it's nuts. But, you know, I'm kind of, that's what we're talking about. I would go. I'd love to see all my old high school friends and everything like that. I haven't talked to a lot of them in a minute.
Yeah, I would too. Do you have any siblings?
I have 2 brothers. I am the middle of it. So really? I am pretty much a boy myself in a sense. Yeah. Nice. Grew up in, my 2 youngest uncles are within like a 10-year range with me too. So we all grew up together. And Mexican family, my mom is one of 7. So each kid, I would say, has 3 kids. 3 to 5, 6 kids. So it's a big family. Yeah. I grew up at my grandma's house. We were always running around. That house has never been quiet in 20 plus years.
Wow.
Mm-hmm. She loves it.
Yeah. Well, I bet that's like it's a nice feeling. You know, you have all your family, but annoying at times too. You know, for sure.
Yeah. Holidays are great. You know, everybody's all loud. We gotta always go to the biggest house. Yeah. It's good though. You know, I like loud houses. Those are always best to me, and that's why we always talk about like the babies. Like the babies will be fine. They'll fall asleep. We can have the speakers blaring, and babies will be sleeping. That's how loud we like to keep it. You know what I mean? And it's a good time. I love it. And me, I live by myself, and so it's like quiet is so crazy. But I have 2 dogs, so they keep it a little loud. You know what I mean? Like I always have to have something. It's kind of weird how much my childhood, I guess, plays into adulthood.
I gotcha. Okay. Anybody in your family that are in the medical field?
I do have a aunt. She is a nurse at St. Mary Corwin. Other than that, I want to say that's it, actually. Really?
You're the first, like a first gen kind of deal?
You know, my older brother, he's a welder. He now is in the solar field. Well, company. He has his own company.
Congrats.
Yeah, he's doing really well for himself. And my little brother's only 18. He's still in high school. He wants to be a athletic trainer, so he wants to go out of state for school. So hoping for him, but I'm gonna be all sad. Like I said, grew up in a Mexican family. He's my baby, and so I'm like, yeah. But you know, it's always great. But yeah, to say, other than that, my brother's technically first gen. He's the first to graduate from college and everything, but. Otherwise, yeah, I'm the other first medical other than her.
Nice. Well, good for you. That's awesome.
Thank you.
You're welcome. So what inspired you? Anything like growing up, or was it something like you went to school and you did mention that. So was it something you were just like, hey, like I want to try it, or did you have like any friends? Like what kind of inspired you to go down that route?
I've always been really good at taking care of people. I'm a nurturer at heart for sure, and I know that was like something. So that's why I kind of went towards the criminal justice, and then I was wanting to do even like social service and stuff like that. But I also know I don't have the heart with that. I would definitely take that stuff home or just be very angry with a lot of people about it. And I just would I seen it negatively affecting my life already. And I have friends that are in the social work and I see it affecting them already.
Okay.
And they've been there for about a couple years. So I knew that wasn't for me. And I worked at an urgent care because I did not want to work at a hospital. I did not want to see people die. And unfortunately I did, but it's just something that I didn't want to see, and that's why I made the choices that I made, you know what I mean? And I tried to take my precautions, but I mean, things happen, so.
Okay. Okay. Sweet. Okay. Let me.
You're just thinking, huh?
You said so much, and it's like I want to dive into everything.
We can talk about it all, whatever you want to talk about first. 2020 was a crazy year.
Okay, so you went into urgent care, and then you switched to the administrative role as of October?
As of end of August.
Okay, so were you working in the urgent care like through those full 4 years? Is that where you were in urgent care? Mm-hmm. Wow, really?
Yeah, I had a partner to begin with, and then she got pregnant, and so she went on maternity leave and just never came back. And then I never got a partner. Mm-hmm. And so I was by myself for 2020 until I left. I got students all the time from Intelitech.
Really?
I never got another partner though. Yeah, and so then my boss had left, and so I pretty much was running the urgent care from 2020 to when I left. So I have no idea how they're doing. I hear it's like a sinking ship. Mm-hmm. Prayers to them, whatever, but I kind of called it all. I think your managers and like CFOs and a lot of like even payroll people in HR play a big role, and a lot retired 2020, and then after that it kind of was just a downhill. It was kind of really weird to see and unfortunate to see, because I really did love the company that I worked for. I really thought I was gonna like die by them in a sense. They were great, and then as soon as a few people that were really important left, you seen the shift, and it was a negative shift, and it's really unfortunate when you're a part of that company, and that's kind of why I felt like I had to leave. And I know I didn't want to do direct patient care because I was just very burnt out, and because I was like doing 12, 13-hour days by myself, seeing 20 minimum, 80 maximum a day in a 12,
patients?
Yeah, by myself with one other provider.
Okay. How different is it from working in like a hospital setting in a clinical setting? So like, like
I've never worked in a hospital, so I couldn't tell you.
Is it similar to working in a clinic? Like a doctor's office?
No.
Okay, so in urgent care, what's the difference between urgent care and a hospital?
So, I would say we usually get the lower level stuff, just like your sprains, your small lacerations, your broken bones, pneumonia, everything like that, COVID. And that's what I was kind of talking about when I brought up the deaths. Like, it's really unfortunate. A lot of people, again, in 2020, were very afraid to go to emergency rooms because of COVID, when they had COVID and they should have been there. And people are also afraid just because of ER bills, everything like that. They don't want to pay for it. And a lot of people didn't believe in COVID. So they're like, this is just a bad case of pneumonia. Mm-hmm. But unfortunately, the man that had died, that passed away in one of our rooms, he was elderly. It was COVID. And
he died in one of the rooms?
So when we would have people check in, we would just have you wait in your cars, and then we would call you in when it was your turn, so just to minimize the exposure. And his daughter had checked him in, and so we had not seen what he looked like at all. My receptionist was really good on triaging, in a sense of just being aware of how bad their wheezing is, how bad their breathing is, just how they look right away. And so she wasn't there to see him, or else she would have said something. She was there for at least like 8 years. Mm-hmm. She was there double my time. And so it was his time to get called back, and he was like yellow already, like gray almost. And brought him back, And then I think when the pulse ox was on him, his oxygen was in like the 60s. It was like 67. And then, passed away.
Wow.
A couple minutes later. And then I had a elderly lady. So then again, urgent care, we're first responders to anything that happens on the property. Mm-hmm. And what kind of irritates me about that is that we were filled with MDs, and at the time it was just one MA, me, and a PA, my provider that I had that day. And an elderly woman had, I don't know if she had hit the automatic door or if she just tripped or what happened, but had fell back and hit her head on the sidewalk. And by the time they had alerted us and we ran out, she was already like foaming at the mouth. And we don't have, forgive me, I could not tell you what it is, but the tube that you put down their throat to open it up.
Innovation tube?
Yes. Thank you. Did not have one. And we also did not have anything to suction it out. So we literally had gloves pulling this out of this woman's mouth while I was doing that. Not even a volunteer. He was a state patrolman there for a work comp. And he was already starting CPR while I was doing that, and my PA was getting the electrodes on her so we could shock her. And did that, nothing. I switched on to CPR. I look up, and there's an MD there just looking. Not stepping in, just looking, while me and a state patrolman and my PA and another MA from work comp are trying to keep this woman alive. And she passes away on that front little door. And everyone from Parkview, because we were a 3-level clinic. Parkview was on top, we were in the middle, and then imaging was on the bottom. And MDs, nurses, everyone around, and we were the only ones to be helping. And I thought that was ridiculous. And that was my turning point there to where I just started having resentment for that job. And it just kind of started being downhill from there. To say, like, patient-wise, like, there was people actively having heart attacks coming in. We had people, again, in COPD exacerbation. We almost lost a woman there. We had people having seizures in the lobby, and they were there for seizures that had, I think she said, like, 3 or 4 that day already. Should not have been in urgent care. Definitely should have been in ER, but people just don't want to go to the ER anymore. So we were almost like a freaking ER, but not ER equipped. You know what I mean? Mm-hmm. We were getting all the same patients, but not having anything similar. And some people thought we were the emergency room. And so it's really hard to go about how do we inform the public of the difference of an urgent care versus an ER, although we know people think we have CT, MRI, everything like that. Like, people don't understand the limitations of what an urgent care has. Like, yes, we can suture you. Yes, we can put you in orthoglass. It's not the same as a cast, though, and people don't realize that. Like, the public is not educated enough sometimes to even know the difference. You know what I mean? Between an orthoglass splint and a brace and then a cast. Yeah. You know?
Yeah. Wow, that was great. That was a great description. I didn't know any of that.
Yeah.
That's crazy. That's so... Wow. That opens my perspective on urgent care. Mm-hmm. Clinic is a little different. I've gotten to see it a little bit. I'll get to see a little bit of the clinical side as well, but urgent care... Wow.
Yeah, and I mean, all urgent cares are different because... once upon a time, I think they have discontinued it. It was that urgent care right by that Adolfo's on the south side, by that south side Walmart.
Yeah.
They did ultrasound as well, but I don't think they do that anymore because I think their tech they either fired them or they quit, and so they just haven't hired another one. But they used to do that, but again, ours never did. You know what I mean?
Yeah.
Crazy.
Okay. Any like childhood experiences that
led me to the ER or anything?
Led you to the medical field? Anything, or was it just?
I mean, like, as a kid, like, I always loved playing that little operator game. Do you remember that on the little man? And it would, like, buzz if you touched it.
Wow.
Really? Just stuff like that? I mean, you always have the little nurse doctor thing, and you're always doing it on people. But like I said, like, I've lived in a Mexican household. I've been taking care of kids and other people since I was, like, 8 or 9.
Yeah.
You know what I mean? And so I've just been doing it my whole life, and shitty way to think of it, but a lot of people do it, but might as well do it to make money if I'm doing it with other people. You know what I mean? And unfortunately, a lot of nurses, like, a lot of them aren't in it for the right. They're in it for the money. You know what I mean? But again, that's why I think if you're in it like that, don't go to the hospital. Go work in, like, cosmetics or something. Because you're going to make some good money there, too, doing some Botox, doing some eyelash injections. Like, even in the family medicine, they were doing eyelash injections, Botox, lip fillers, everything like that. In a family medicine. So I thought that I seen that, and that was really cool to see. In the eyelash injections, you can literally see the needle moving in their top eyelid.
Oh, man.
It's crazy. And it did not hurt. Well, I mean, they obviously numbed them, but, like, the patient was like, no, I can't even feel that.
Nah, that's crazy. Okay, so you went to Grand Junction. Did you finish school and then go to Intellitech?
Absolutely not. No.
Okay, so you just
never graduated college.
You went to Intellitech in Grand Junction?
And just accrued a bunch of debt, yep.
Yeah?
Yeah, so I always think about it, and that's why I'm like, your earlier 20s are for jacking up, and that's exactly what I did. And, I mean, I'm definitely paying for it now, but, again, like, I'm kind of glad I did what I did because it's led me to where I'm at, you know what I mean? Who knows if I just would have kept going with criminal justice or social work, and I would probably just be, like I was telling you, resenting it, you know what I mean?
Yeah, I know someone who's going to school for criminology. I don't know. The person wants to, I don't know, be in law enforcement.
Yeah.
So, yeah, but they're stressing, too. It seems like people like that, not like that, but people who go to school are stressed and just hate their
and sometimes it's
sometimes.
peer pressure. And what, like, really sucks is that, like, my mom never talked to me about college. She never talked to me about, I never really even thought about what I wanted to do for the rest of my life in high school. Like, I was just living for the moment. I never thought about my future. I never thought about applying to colleges. I was taking classes at PCC, and I was doing, like, the AP classes in high school and everything like that. But I was just doing them because my mom was making me do them. You know what I mean? Like, I wasn't thinking, like, oh, like, this is going to, like, I loved biology. I've always loved science. And so I always wanted to kind of go somewhere in that. Like, I've always kind of wanted to work in a lab. But I just don't know, you know what I mean? And to say I'm still 25, I definitely want to go back to school for something. I just still don't even know if I want to go in a higher administrative or to be, like, go for HR or something like that, or just go on a whole different business side, or if I even want to open up my own business someday, you know what I mean?
Yeah,
like,
I feel you.
Still figuring it out.
Yeah, exactly. We're all just figuring out, as we go, day by day, as we live, life. We're just figuring out, we're just kind of taking life with the punches, rolling with the punches, taking everything with a grain of salt, kind of thing.
Yeah, and then to say, like, life still happens, you know what I mean? Like,
exactly.
Went through breakups, went through heartbreaks. Came back home, moved back in with my parents, like, doing all of that was so stressful, and then having school and everything on top of that was even more stressful. Like, that's why college sometimes, it just was not for me. Like, I'm not a school person. That's why I was like, not that I'm lazy, it's just like, I just can't, I don't know, I just can't keep going for that long. But I mean, I'm just gonna have to. I'm just suck it up and just do it. You know what I mean? But I guess
that's the mindset you gotta have at the end of the day. Is people who are there for the long term, like doctors and nurses. They're there for the full 4 years. But it's crazy. How long was it to get your MA? Was it like 9 months at Intellitech? Okay, it was 3 months to get my EMT at PCC.
Shut up.
Crazy. Well, I guess it was 6 months total for the whole, like, training, because I got my IV, quote unquote IV. It's on a certif.
Yeah, I got my phlebotomy cert with it.
I can draw blood. Yeah. I mean, using a needle is just using a needle. Is it
the tubes that jacks you up, or what?
No, I mean, you stick the needle in, and then you have certain things for certain stuff. Like, I mean, I'm comfortable with using a needle. That's really all it is.
Yeah.
So if you're good with that, you're kind of kosher on everything else.
I hate the rolling veins on the hands.
Yeah, they suck. So I mean, I don't know what being certified in IV kind of enables me to do. I know I can just do IVs and do certain type of medications. And then I did, like, an EKG course, so I know, like, the basic understanding of
your QRS.
Yeah, QRS, the P wave, the Q wave, the T wave, all that. Yeah, it's super cool to understand and learn. I enjoyed it. It's cool. It's cool. You hook that on to someone, and you can kind of...
You can see when they're in, like, AFib and stuff like that.
Yeah, you can kind of see how their lifestyle is, like... just everything. You can get a picture of their heart and their like the human body itself. It's so cool. Medicine's so cool. It goes so in depth. It's crazy.
I know. I wanted to go in different ranges. Like, I love my rad techs. I love just seeing their X-rays. I've always even wanted to go to like mammo and stuff like that. Like, it's just, again, the spectrum is so broad.
So broad.
I love it to say, like, it even goes into, like, sports. Obviously, there's sports medicine and everything like that. Like, that's what I'm saying. When people go to be nurses, like, you don't always have to be a horrible person to go work at a hospital when you know you don't need to work there. There is so many other things you can be doing. You just need to go look for it. Because I am tired of seeing bad nurses in hospitals. Not bashing on nurses, but there are a lot. Like, it's just so sad, the stories I've been seeing coming out, like, all over the country, you know what I mean? Like, even pediatric nurses, like, if you don't have the patience for it, just don't do it. Especially even in geriatrics, you know what I mean? Like, CNAs, we can even go there, you know? But that's one thing I'm glad I never had to go through, was take, like, a CNA course, because I think the MAs have to do CNA courses now.
It's a little, I've heard it's hard. It's hard.
I can't be wiping no asses, man.
That's it. Yeah, all that care. Yeah.
That's what I think about, but
this all kind of brings. It's great. We're touching on everything, and it's like, man, I love it.
Answering all the questions.
Yeah, it is. It is without even like asking them, but it does bring me into some other. I gotta ask them. So working in this field, you meet a whole bunch of different people, right?
Mm-hmm.
At urgent care, you'll probably meet physicians, nurses, MAs, all that stuff. Mm-hmm. At a clinic, for sure, physicians, MAs, all that. Hospitals, same thing. First responders are different. It's a totally different ballgame from pre-hospital care to hospital care. So that's something I kind of wanted to get into too, as well as the people, like different healthcare providers you meet, like doctors, and yeah, that's really it. Like, what kind of providers do you meet as far as like urgent care, and how different is the practice from urgent care than pre-hospital care?
So for urgent care, I've worked with MDs, PAs, NPs, and a DO.
What's a DO?
It's more of like an orthopedic thing, but he was actually the person who ran the urgent care at the time. It is... Doctor of Osteopathic Medicine.
What is that?
He was the work comp doctor.
Work comp?
Mm-hmm. So occupational medicine.
Oh, what is that? Like
work comp.
Okay.
Occupational work medicine. You know what I mean?
Okay, I'm still not tracking. Like, what kind of...
So he is a doctor of osteopathic medicine.
Which is?
You're going to make me get on to it. I'll read the whole thing.
I don't know what that is.
He is a fully trained and licensed doctor who has attended and graduated from the U.S. Osteopathic. Are you pretty much asking what osteopathic medicine is?
Yeah. Is that different than, like, pediatrics or, like, working with, like gynecology? Is it, like, a certain type of...
So it's a treating the entire person rather than just the symptoms. So that's why he works in work comp.
Okay.
Because you see the injuries and everything like that. But,
okay, go ahead.
So he was the only DO that I had ever worked with. But other than that, I've worked with multiple MDs, majority PAs, and about 3 NPs.
Like medical directors? Is that what...
No, providers that I worked with alongside.
Okay. You work with any, like, medical directors or, like, past medical directors for like, ERs?
Actually, we did have a ER doctor, Yuri Rothbaum. And he works at a ER, I believe, in Springs. He worked at Parkview once upon a time, but he is in Springs now, I believe. And I worked with a nurse practitioner, Marissa. Oh, girl, you're going to hate me. I cannot remember your last name for the life of me. Oh, I love her, but she is a nurse practitioner over at St. Mary Corwin ER, I believe. Love ya. She works alongside with my aunt over at the nurse.
Oh, sweet. Nice.
That's a nurse over there.
Okay.
So they know each other. It's really cool.
Okay.
They're friends.
Nurses. Okay, so like nurses, MAs.
We do not have any nurses in
really?
The urgent care.
Urgent cares?
No.
Okay. Is that only like a hospital thing?
Yeah.
Wow. Okay.
Yeah. We have a nurse that worked in rheumatology, but that's really about it. She was never in the urgent care setting unless she was like covering a shift.
Mm-hmm. Mm-hmm. Okay. All right. So how is it different than the pre-hospital care setting? Would you...
What do you mean as in pre-hospital care setting?
So pre-hospital care is like... well, that's what I want to get into. So that's like what... the fire service is starting to get more into is like responding to 911 calls. Grandma fell down. You know, you gotta rush her to the hospital. You're having a heart attack. You gotta rush him to the hospital.
Well, I would say the difference would be is that sounds more of like triaging and assessing. Boom, making a decision. If you're okay right there, just go drive her down to the local urgent care, or boom, it's severe enough. Let's take her to the ER. Versus if they were to come to us, we would assess them fully, treat them, and then go from there on out. So the difference is they're not getting treated at site.
Okay. Is that something you ever like thought about like doing?
Honestly, I really do not want to ever go back to direct patient care.
Really? At all? Like you?
No,
you
I had after 2020. You know what? I'm sure family medicines, ERs, all the fucking parts in the hospitals can agree with me that patients got horrible.
Oh, that's
they
so
got
bad. That's
mean.
horrible.
They got rude. I've got told I'm going to hell. I can't tell you how many times I got told that I'm a bitch. I can't tell you how many times.
That does make a lot of... Okay, I understand that
and
for
so
sure.
it increased more when COVID hit because it became patient only. So wives, grandmas, sons, daughters, everything couldn't come back. It was a huge thing. Wives... I definitely realized how many wives baby their husbands. I'll tell you that. And know their medical history more than husbands know their own.
Really?
Yeah, they're like, I don't know what I'm allergic to. She does. And I'm like, that's horrible. That should not be normalized. Like, know what you're allergic to so you don't die, bud. Because what if she dies before you and you don't know?
Yeah.
You know what I mean?
That makes sense.
I love the dependency, but like, know at least something about yourself. Okay. You know what I'm saying?
Okay. Yeah. All right. Do you like... A lot of people... I like I like the fire service. First responders, I just want to interview them. And I just want to interview everybody and get to know their story and all that. But do you like first okay.
As in
cops? I can understand cops. I mean, to an extent.
Do I like
cops.
EMTs? You know,
yeah,
I do.
EMTs, paramedics, firefighters are the big ones. Like, do you like firefighters?
I love firefighters. I'm grateful for what they do. You know what? I met a firefighter.
I should have just jumped straight to that question. That was
do I like firefighters? Yeah. Who doesn't like firefighters?
Who doesn't like firefighters?
I'm grateful for them. They be keeping us not under fire.
Shout out to all the firefighters. Exactly.
Absolutely. I met a firefighter at Old Chicago years ago. And that man and his wife were the funniest people that I had ever met in a long time.
Okay.
Great
Did he
people.
have a mustache?
No.
Okay, continue.
No. But him and his wife were a grand time. They were the nicest people ever, and that was probably the only interaction I've ever had with a Pueblo firefighter.
Really?
Yeah.
Okay, what about you said Pueblo, so I'm assuming you have...
Well, I guess any firefighter, I don't know. Not any other firefighters.
Any EMTs? Like, have you had...
I have,
do you
obviously...
know any, like, EMTs
I don't know any
medics?
EMTs personally, but I've dealt with a lot of EMTs that came to urgent care when we called AMR to transport patients and stuff like that.
Were they, rude?
Somewhere.
Okay.
There's definitely
the
an old, heavier man that has glasses that knows who I am and I know who he is. And he was not nice to me and I was not nice to him. I do not know what it was for. I do not know what I ever did to this man. Don't get mad at me. I will tell the story that kind of initiated it all.
All right. Don't get mad at me, AMR.
So, I'm sure I've called them a dozen times. They're probably sick of my name after the 4 years.
It's patient care. It happens. It's
and
like
so what had happened was, it was one of the patients, again, a seizure story. She was dropped off by her husband. He just dropped her off, and she was having a seizure in the lobby, and he just bounced. And so we called him off her phone to come get her, to take her to the hospital. He thought my provider was her lover, although he knew he dropped her off at an urgent care. So fighting with my provider over the phone while I'm wheeling her back to our triage room. I get her blood pressure. It's tanking. Her back starts turning ice cold. Everything like that. We get diazepam. I freaking just shoot it in her. And then I forget what else we get in her. And it was super hectic all that time. She she was so out of it and comes out and she was like makes this bat out of house sound I've never heard out of my life, like a type of freaking sound like that. It was weird. It literally sounded like she definitely was resurrected. And give that to her. Does that and she was like, I'm gonna kill my bastard kids. And I was like, whoa. And so AMR comes in at that time, and then she goes out. And then back into a seizure.
Okay.
So then AMR's in there. He's trying, as she's like actively convulsing, he's trying to get an IV in her, gets a needle in her.
Not good.
Why are you trying to put a needle in her while she's moving? She's not stabilized. I'm holding her head still.
That's a reasonable reason.
Thank you.
Yeah.
So then blood starts squirting everywhere. I'm holding her head. My provider starts grabbing towels from the cabinet to start wiping the floor down, and he was like, "You're not an MA, you shouldn't be doing that." The freaking look on my face and my provider's face, that EMT said that. Wow. And he was like, "Well, who's the one that made the mess?" And that AMR just shut up, and then all the other EMTs that came in made him leave and everything. Like, and then after that, I had never seen him again. But me and him had gotten into that like previously a lot of times before. That was just like the climax that just like set it off. And I was just like, why would you do that? And then you're gonna make that comment when you just messed up and did that?
Yeah.
And they're like trying to get a blood pressure, so then boom, pressure. Why are you putting a blood pressure on her while she's actively bleeding? Like, I literally was just like, no one is thinking right now.
That is
Or
dumb.
at least try to put pressure on it to stop it. Like, her hand is flailing around, blood's going everywhere. Like, and again, just one provider, and we had all the other rooms filled up.
Yeah, I understand your reasoning, but I mean, in those situations,
love you EMTs and AMR all the time, because you guys always did come every single time, quick as hell when we needed you, and you made all of our patients survive. Thank you.
But in those situations, it's really like, it's different for one, because like when that happened for you initially, you had to do your job, and then you guys had to call 911. So they arrived and they had to do their job, and they had to get everything from what you did. So since you gave them that drug, or you administered that, they have to take that into consideration. A whole bunch of factors play into consideration. And yeah, it's going to be stressful. Like,
and then when you call AMR directly,
that's the reality of a situation. That's the reality.
Excuse me, I'm so sorry. They have about 15 questions to ask you before they tell you that somebody's on their way.
Everything.
And I tell them everything, and I'm like, oh my Lord, like, I am trying, like, I cannot be on the phone answering all these while there's just me. Like, so a lot of the times I'd have my receptionist do it, and she would be yelling, asking what did you get in this? And I'm like, you need to come over here, because that is HIPAA if I yell back at you, because even we shared an office with occupational medicine, so our whole lobby is a mixture of everything, and the walls obviously are thin. I'm like, no girl, you gotta come over here. So then it still delayed time on it in every ways. So AMR, that is my only suggestion to you. Just make that questionnaire just a little bit shorter, please. It'll save time and save lives.
Yeah, okay. So as an MA, like, what are you able to do? But I know it's kind of different working in different facilities. So in urgent care, you're probably working under like a physician's orders, so you're probably able to administer whatever they tell you to.
Absolutely.
But as an MA, you're probably taught differently, but it's still under like medical protocol. So like,
and it definitely just depends on wherever you're working as well too.
True. So
with the urgent care, I have a lot of leniency. So I gave administration. Sometimes I would even do suture removals. I would take out staples. I would apply ortho glasses. I would obviously do physicals, regular vitals, all the assessments. I knew my HPIs very well for certain, like, we had templates made up already, and I already kind of memorized them for how long I had been there. So I know the questions to ask, so it really made the provider, when they went in there, easy, like, in and out like that, and we could go to the next patient. So that's why we were seeing up to like 80 people a day, because it was just so in and out. And we were never downing our patient care though, in the sense, you know what I mean? And so we did a lot, and I mean, it obviously was more extensive when we came to our COVID patients, or our pneumonia patients, because then we were like, okay, if the oxygen is getting lower, okay, let's do a breathing treatment. After that, let's get an x-ray, let's get a chest x-ray. After that, kind of just keep everything going, monitor their vitals, while I'm also trying to see 4 other patients as well too, because we had about 6 rooms, and I usually would try to have them fill up all the time. So I was always trying to see different types of stuff every single time. We would do like nail extractions, like literally whatever came in, we would try to do everything. Like, people that should have gone to the hospital, we saved a lot of people from going to the hospital, just to like let them not have that bill, because no one wants that. No. You know what I mean? If we're able to do it, why not be able to do it? If it takes us a little bit longer, it takes us a little bit longer. You know what I mean? Yeah.
Wow, that's cool. That's really cool. Yeah. That's super cool. Yeah.
So like I said, like, patients we had on that actively came in with our heart attacks, we'd stabilize them the most we could, you know what I mean?
Yeah.
and
You
keep them
said
there.
like lacerations too, like stuff like penetrating
Oh yeah,
trauma.
people would come in with like glass in their head and
like
all this
gunshot
crazy.
wounds.
Oh my gosh! Actually, my first month that I was there was a guy that shot himself through and through on his leg, and he came into an urgent care, blood everywhere. I was like, oh my gosh.
Okay.
So again, had to stabilize him, wrap him up, everything like that, and then hopefully they went to the hospital. I don't know what they did. We did not treat him for any type of infection and stuff like that. We kind of just triaged him, stabilized him, made him leave, and then go from there because he didn't want to transport by ambulance and he can't make them.
Yeah, can't make them.
And so
exactly.
did the best we could, made him leave, and then who knows what they kind of went from there. But yeah, shot himself through and through, and that was the only one that I had seen gunshot wound wise.
Okay. Wow, that's interesting. I didn't know you can do all. I didn't know that's what happens in urgent care. That's crazy.
And to say, like, I remember I had a 16-year-old. He was high off of. He was on like MDMA, meth, and something else. And he said the story he told us was that he was throwing a glass away and it had broke and the glasses had gone into him, and like a hole, I would say maybe like an inch and a half was cut down straight, and then he had like a few cut crazy, and then a piece of glass stuck in on the other side, bleeding from everywhere. His blood pressure dropped to like almost like an 80 over like 60 type of thing. Scariest thing ever. Had AMR come in here, stabilized him as much as we could. He like was refusing to tell us what he had took. He like was about to pee himself, so the doctor literally had to put like a throw bag over his freaking wiener so he could pee right there while we're like trying to hold and like wrap everything else. He's like sweating so much, almost dies in our urgent care. AMR barely got there. I honestly don't even know if he made it. His car was there for about like a week before someone came and got it, but we went out and looked at it and it looked like a murder scene was in there. Blood was everywhere, all on the seat, on the passenger seat, on the dashboard, on the steering wheel, on like the middle console. It was the craziest thing. But to say that was just another day, people would come in all the time with like the highest blood pressure I had seen was like a 240 over, I think like a 194 or something like that, and that scared the hell out of me. I'm sure people have seen higher, but that scared the hell out of me. And I'm sure I may have seen even higher, but that's the one that I remember. And all we had was clonidine, you know what I mean? And it was the 0.1 clonidine, and you can only give that every 10 to 15 minutes, and that really doesn't drop their blood pressure that much when it's that high. You know what I mean? And we can't, let me have like lisinopril or like hydrochlorothiazide in my cabinet because we had like an in-house pharmacy, but never anything like that. It was always like amoxicillin, Augmentin, Diflucan, stuff like that. You know what I mean? Like we would give like Rocephin injections for like infections or like STDs. STDs that I had seen is a whole nother story.
Really? You got some stories about that or what?
The worst syphilis case I had ever seen was from a regular, and it was really unfortunate because I used to see like him and his family come in all the time, and then he would stop coming when the kids would come in, and then his wife would stop coming with him, and then he just started coming in by himself, and then he had a syphilis rash, covered the chest. It was even on the palms of his hands, so that's how you know it was going on for months. Like, the discharge was disgusting. He was just not clean himself. He couldn't give us even an approximation of how many women he had slept in with in a week. So I was kind of like...
He couldn't give that to you?
He was like a sex addict, I'm assuming.
Well, he had a wife, too?
Not anymore at that point, you know what I mean? But he did at the time that when I first met him. But yeah, he had, like it looked STD? Like almost like a...
Syphilis is an STD?
Yes, and it looked almost like a chicken pox. It's like red dots everywhere, and it was on his arms, it was on the top of his hands, it was on the palm of his hands. And when it's on the palm of your hands, that's when it's at like its worst.
You're down for.
So he had definitely an accumulative of things that he definitely tested positive for. Definitely has like herpes and everything like that. I've seen herpes. That is very ugly.
Very ugly.
Mm-hmm. On men and women, I've seen some warts on some penises.
All right, I'm gonna check it real quick. I'll be right back. Hold on.
You're like, I gotta go throw up. I'll be back.
Yeah, it's
so warts on penises.
Great.
Yeah.
All right.
There's a lot of different things that I've seen. Yeah, herpes. Obviously, HSV1, cold sores, everything like that. HSV2 is genital. I've seen it. You said
herpes was really bad?
Mm-hmm. Well, I've seen really bad cases of it, like really bad flare-ups or like first time You know what I mean? Like, I've had patients that have had herpes for years. Like, I had a couple, and it was really unfortunate to see they were about to celebrate their 55th wedding anniversary, and this man for 55 years had hid herpes from his wife.
Oh my God.
And he said he literally, because when couples come in like that for STD testing, I automatically split it up. Because I'm like, I need to get the full story. There is the truth, one person's side, the other person's side, and then God. Okay? Yeah. There's 4 stories. But, so I got that wife, and she was like, thinking it was just like an infected hair, and then she was just having like a BV flare, like something like that. And then he was like crying in the other room when I got to him. And he was like, I was fucking stupid. Like, I got it when I was like 17. Oh. He was like 17 or 18. And he was like, every time we would have a flare up, I would pretend to be sick, or I'd just pretend I wasn't in the mood. And he hid it for 55 fucking years. And he didn't feel the flare up until the day after they had sex. And so then that's how she got it. And now he has to explain to her that he gave her herpes and hid it from her for 55 years. And I have no idea. Obviously, they were out of town. They were Southern as fuck.
Okay.
And so I got patients out of state, out of country all the time.
Seriously?
Mm-hmm. New Zealand? A lot. Weird.
That is kind of weird.
Weird.
What is going on with
And
New
then,
Zealand?
I don't know. I'd get a lot of people from there. A lot of UK.
UK, okay. A
lot of Asians.
Asians, for sure.
Mm-hmm. But, yeah, just always, I mean, they're always a great treat. Yeah. They always got some stories. I'm personable, so I loved talking to my patients. I loved knowing my patients. I'm always just like, oh my God, what are you guys doing here? Because
it makes the job more bearable.
Absolutely, and I mean, it makes a long day a short day.
Yeah, exactly.
You know what I mean?
How else are you going to do your job? That's kind of what you're in the job for.
Mm-hmm.
Yeah, if you're not, yeah, that's cool. I was really nervous at first, but now kind of starting this new job, it's like, all right, cool. Hi, how are you? You know, kind of thing. It's like,
kinda
okay,
your,
cool,
like, routine of it.
Yeah, you got to get into a routine, get the experience, and then once I transfer to a different setting, it'll be like, oh, okay, cool. It'll be like the same thing, you know? So it'll be cool. It's just like a confidence thing in a sense, but it's like a conversation too. But it's like you're a care provider and they're a patient, so it's a different responsibility. But I mean, at the end of the day, you're both human and you're both people, so it's like, all right, I don't want to be a stranger to my job or to you, so
exactly.
You know, at first I was really timid. I did an internship with AMR and I've done a few rides with the fire department and AMR too, so I was really timid. And then once I got my EMT, I was able to do stuff, but I was still like really timid.
Really?
I was like, okay, like, I mean, I got involved in everything, but there was just like times where it was like, oh, okay, like I did a lot of IVs, and I did, help them with, like, second hand stuff kind of things. It was, like, an extra pair of hands and just watching them. But, yeah, I mean, that's really what I did, because I was just too caught up on the assessment, just like, all right, well, what are you here for? Like, what's going on? And then you got to kind of base everything off that. You got to get it. You got to
be quick with it.
Yeah,
your hip hurts left or right. Oh,
yeah.
What does it feel like? And what I even understand is that people, especially even adults, are horrible with their adjectives. They cannot tell me pain. Okay, is it aching? Is it sharp? Is it burning? Is it stinging? Is it numb? Oh, it just hurts. What does it fucking feel like? Because that indicates so many different things. That indicates broken bones. That indicates muscles. That indicates so many different things. Is there redness? Is the redness spreading? Are you having numbness anywhere? Is it spreading down? Is it spreading up? Can you pee? Can you poop? You know what I mean? Like, are you having a fever? People don't take any of that stuff into accountability. And they're like, oh, I didn't think about it. And that's why assessments matter so much, because you ask for symptoms and then they start thinking about these symptoms that they've had, but that didn't know that they were symptoms to that specific injury. You know what I mean? Like, especially with infections, people are like, yeah, it's hot to the touch. You didn't know that, like, and again, a lot of people don't know that means infection. A lot of people, like, they're just like, oh, like, it's just, like, irritated or something. You know what I mean? Like, it's really crazy. And that's why that matters so much. And that's why I kind of, like, sometimes you do have to take your time with the assessment. But, I mean, also, like, depends on the severity of everything that's going on. You can also take it and take your time and then not take your time, Boom, 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 straight to the point.
Yeah, I feel you. So in this job, how big is mental health as far, I mean, yeah, just in general, you definitely experienced, a
You know,
lot in your career, and you probably met a lot of people too who, I mean, there's two, well, there's a lot of mindsets, but there's two big ones that I've seen. One that it's a 9 to 5, and that's a real stressful environment for themselves because they were stressed about paying their bills, just the money situation, and then just working a 9 to 5, all the responsibility that comes with that, and just the stress they see too, all the stuff they see, so they got to deal with all that stress. Those are really the two big ones that I've seen, that kind of take a toll on people's mental health. I mean, but attitude, everything. It takes a toll on everything. So how big is mental health for you, in
for
that?
myself, or just to say, like, in the medical field?
Both.
So I would say in the medical field, for myself, I am very mentally strong. I promised myself from the beginning that I would not take work home. And I definitely struggled with that for a lot, because there's definitely a lot of patients that you worry about if they're going to live or not. But you also don't know that person at the end of the day. So that's what I kind of try to think it as, that that's my patient. I did the best I could, and they're in a better care than me, and hopefully that they are getting that. And that's what I always try to keep it as, is that I gave the best care that I could. And once they left my care, that's the other person. That's not on them, that's on me. And a lot of people struggle with that, because a lot of people are like, oh my gosh, I could have done this, I could have done that. It's not about that. It's what you do in the moment, and that's why you have to be on top of your game, and you have to cut the bullshit out. Everyone goes through something, I understand that. But you gotta cut the personal shit out once you walk into your shit. Especially in urgent cares, especially in hospitals. You just gotta cut the bullshit out. You have no time to be thinking about other things when you're focusing on someone else's life. You know what I mean? Mm-hmm. And so that's what I say. The people that are like so get attached to patients right away, everything like that, that definitely calls for, you're right in some ways in the medical field, but I wouldn't say in those certain levels. I would say possibly like a retirement home, like stuff like that, like a chemo center, you know what I mean? But, or what is it, like the end of life, what is that one?
Hospice.
Like that, perfect. But to say, like, you can't be lagging on nothing in those times. You got to be really on your A game, especially in the ER, especially on ICU. So I would say in healthcare, there's definitely a mindset you have to have, or have to be able to create and maintain. But other than that, it's what sucks is that, especially since 2020, burnout is at an all-time high for sure. The patients are getting stacked. There was even a nurse shortage, and like, you know what I mean? Like, it was a crisis for a moment, and it's just, it gets to you. And so, yeah, sometimes you do get mentally weak. Sometimes you do get tired. Sometimes you do fall asleep. Sometimes you do lag, and it fucking happens. And it sucks. It happens to MDs. It fucking happens to NPs. It happens to CNAs, MAs, nurses. It happens to all of us. Rad techs, anything like that. But nothing a shot of an espresso and seven coffees can't fix, you know what I mean?
It's mentality. Yeah.
Definitely a coffee addict and vitamin D deficient off this job.
Yeah. Yeah, I wanted to touch on that because I don't know how, it's probably it's very similar. Medical field, healthcare, everything's just similar. You're dealing with patients. Yeah.
They all are hand in hand.
Yeah, I just love the fire service. There's some pros with that. You have a family there to talk to. And, you're spending 24 hours with like 6 people, 2 people.
Absolutely. And that's what I even considered, even my coworkers at the urgent care family, because I was spending holidays with them, because at an urgent care, you can't close. Mm-hmm. So we were open on everything. Yeah. We were open on Christmas. We were open on, I think Thanksgiving was the only one that we were ever off. Christmas, we were open. Yeah. Christmas, we were closed. So Christmas Eve, we were open.
It's nice to talk to people, they're
my family. Yeah, I was with them more than I was with my own family a lot of the time. You know what I mean? I still talk to old coworkers to this day. Yeah. They're my family. Yeah. Love them.
But it's really, like, relevant. A lot of people don't see it, but it's really relevant. Mm-hmm. The mental health, the awareness around it. Mm-hmm. Well, just, like, the whole just really big. Really big. A lot of people don't talk about it. And
I think burnout's not talked about enough.
Everything's not talked about enough. The suicide rate is super high with first responders and just Yeah.
And you know, I give my heart out to EMTs because I know you guys see some shit going on, like car wrecks, going on. You know what I mean? Just you're really first responders to everything on that spot. You know what I mean? If it's not, it's the firefighters. I see them all get quick, and it's just, I'm sure, like, that's traumatizing for sure. You know what I mean? Like, I couldn't imagine seeing someone mangled around a tree or something like that. You know what I mean? Or like the cops that bust in on like suicides or anything like that. Like, that's tough shit to see. To say, like, I know I've seen some tough shit, but I know there's tougher shit to see. And it's horrible. Like, this is really an ugly world. But at the end of the day, these are the careers that we choose, and we choose them for a reason, and we have to stand by that. And I do, you know? Yep. And again, I still, I always say I don't want to go back to patient care, but I still kind of do it in a sense. Like, I still interact with my patients at the clinic now. Like, they're super cool. I see my patients have good days, bad days. I talk to them about their relationships, everything like that. You know what I mean? Like, and with addicts, you get good days and bad days with them. You know what I mean? Like, you get them when they're really nice, and you get them when they're really angry, and they just cuss you out, and you're the worst person in their life, you know? And so that is definitely a different population that I never seen myself working with, but I'm kind of glad that I'm experiencing this right now as well, too. Yeah. Because it definitely gives me a different perspective on how to treat them medically. And I mean, I've had a Narcan people before, but to say, like, the research I'm learning about them, and especially what makes me really, like, upset sometimes is, like, the fentanyl use in, like, teens. I've gotten my youngest patient, I believe, was like 9 years old.
Really? Off an overdose on fentanyl?
No, they just come in. So it's a substance abuse clinic, so they kind of come in to try to stop them. I can't remember what else it was. It was weed and something else.
It was a substance.
Yeah, so we test for it. No, but they're brought in by their guardian. So we try to do everything we can to, like, get them to stop, like, wean off of it in a sense. We have, like, behavior health and everything.
Like that?
Yeah.
Okay.
Yeah.
Wow, that's crazy.
Not in this job yet, but like.
Okay, but as far as, like, urgent care, have you?
Yeah, we've had a Narcan someone in like the bathroom and everything like that.
Was it like the intra and the nose? Okay, it's crazy. How long did it take for it to work?
Oh my gosh! Immediately.
Really?
Damn near.
It's crazy.
Damn near. It was nuts. It was the scariest thing, and there's a few times that's almost happened. And it was always in, like, the public bathroom and the part that can kind of go for it, but it was crazy. And I mean, I haven't had a Narcan anybody myself yet, and I hope I don't, but I mean, I'm always ready. You know what I mean? It wouldn't be the first time. I'm sure there's never going to be a last time. And I always keep some with me. That's why I kind of like that clinic, because they give it to us just in case if we ever see anybody anywhere. We always have it, because not everybody has Narcan. You know what I mean? And the substance abuse in this town is very, very high, but it's also very, very high in Walsenburg. I travel, so I'll go to, like, Trinidad, Walsenburg, Canyon City. There's, like, Los Animas, Lahana, Springs. Like, we have, I think, 60 plus locations in Colorado, but those are the ones that we visit. And Walsenburg is very bad, especially with fentanyl. Like, the amphetamines, MDMA, all of our patients are on, like, heroin, everything like that. It's super sad. So again, that's the most where I see, like, the good and the bad, because I'm there on Mondays and Wednesdays. And so, yeah. But I mean, it's also really nice to see patients that go from being, like, 2 times a week to being, like, every 3 weeks, because they're stabilizing now. You know what I mean? So I see my patients have their babies and they're doing good, but then it's also upsetting because then I see patients have the babies and they're still using, you know what I mean? And so you see the good, the bad, and the ugly.
I gotcha. So speaking about careers, is this something, like, you see yourself doing in the long run? Like, do you see yourself retiring in this kind of job field?
You know, I've been thinking about that a lot, because I'm an admin 1 right now, but I'm hopefully moving up to an admin 2 very, very soon. And so I've only been there for a few months. And so already moving up to an admin 2 is really big to me. And so I kind of just want to keep building and see where I'm at in a year. And I definitely want to go into something regional. Like, there's a lot of different positions. And I mean, I wouldn't even mind going into the behavioral health section. You know what I mean? Like, with this job, it's almost like endless opportunities of where you can move up to. And that's what I really love about it.
And administrative work?
Yes. And that's what I'm saying. That's why I also wouldn't mind even, like, going back to school for this stuff. If that's required for me moving up, I would have no problem with it.
What kind of opportunity is there? Is it like tech involved, or is it like?
Not necessarily. It's just really just the administrative
role.
And so again, like, I would love to start doing, because I am very grateful for what my job duties are, because it is almost 80% less of work.
That's cool.
Than what I was doing before.
That's pretty cool.
I'm working so much less, the work is less and the pay is more, and that's all I can be really grateful for. You know what I mean?
Yeah, so you can't really determine. I mean, I can't really determine what I want to.
I can't tell you what I want to do.
Because, I mean, I want to start it. I mean, I don't know. I couldn't tell you either. But, I mean, I do want to have multiple sources of income. So, like, what are your, like, goals? Do you want to have this as a career and have, like, other sources of income?
Absolutely. I do want to invest in property and do, like, rentals and everything like that. I always say I hate landlords, and I'm like, okay, I kind of want to be one.
Me too.
Yeah, but I do want to do that, because I definitely want to start some generational wealth shit, too. You know what I mean?
For you or your dogs?
Both. My nephews too. I really don't want to have kids. I don't see them in my near future. Definitely not in the next 5 years. My 20s are for me, and so in my 30s, if I find somebody, who knows. I'm single right now, so that's really kind of what I'm focusing on. Me and my brother are really trying to do a lot of generational stuff, and so I definitely want to do a lot for my nephews. My nephews are like my kids. I love them to death, and my dogs for sure. You know, my dogs are my loves. Have the best life. I'm about to get them some little beds. Little beds. But yes. You know what I mean? Like, again, like, I do want to start working hard even more and get, again, multiple sources of income, because I want to get a huge yard for them. You know, the yard I have now is pretty big, but I want to get an even bigger one. Like, you know what I mean? Absolutely. Like, they have a short life. And that's what I believe when I say, like, dogs deserve to have the best lives. Their lives are literally a tenth of ours. Their time span is just, what is it? 1 year is 7 years for them, or 1 year for us is 7 years for them. Like, that's ridiculous. So one of their days is equivalent to what? Like a couple hours almost?
Yeah, a few hours.
Fucking A. So that's why I feel bad, because I have them they're kennel trained, and so they're in their kennels when I'm at work, and I'll go home on my lunch and stuff like that, but can't when I'm out of town. So when I'm home, like, that's like the best time that they have. Like, that's their best life, you know what I mean? Because they're definitely inside dogs. They're outside as well, but, like, you just gotta do everything that they can. But I also get when people have, like, the guard dogs and then, like, the ranch dogs, and their lifestyles are all differently. Like, I totally get every dog has their purpose, but if they're gonna be, like, your pet like that, like, you gotta give them some shit. You can't just, like, go have them chained up in the backyard. Like, I just can't I can never get down with that. You know what I mean? But that's kind of totally completely off topic.
No, that's okay. Speak on it. That's okay.
I love it. I love my babies.
It's great. Yeah.
My loves.
It's great. Okay. Yeah, I feel I have 2 cats. That's it. I like dogs. I like animals in general.
I had a cat in Grand Junction, and I loved her. Her name was Mama's. She was a black cat, and I loved how independent she was. I loved how much I didn't have to. She was always around the house. You know, the only thing was that she had her claws, so she ruined the couch and the blinds. Mm-hmm. But again, nothing that can't be replaced. You know what I mean? Like, she was the greatest cat, but R.I.P. I don't know if she's dead or not, but she was, again, my baby. I babied her, so I was carrying her like a dog, like a baby. Yeah. And my downstairs neighbor had a pit bull, I believe, and she was super friendly with us. She even knew my cat. My cat and her loved each other, but I was carrying her, so my cat didn't see her, and the dog came and, like, jumped on me, scared my cat. My cat, like, dug her claws into my shoulder. I, like, and then she just, like, ran. And I never seen her again.
Oh, man. That's so sad.
And I lived right by, like, a boulevard, so I don't know if she ever got hit or anything. I hope not. Sad. But then I'm like, yeah, dude, I never seen her again. I put cat food out and everything, and I was on the upper level, and she hated the stairs. So that's what I'm saying. Mamas, I love you. But, yeah, it was... She was a good cat. But, yeah, I loved how independent she was, but she was also super clingy.
Gotcha. Yeah.
Cats are great.
I love cats. I love animals in general. Yeah, I think... Well, that's it. We're gonna wrap it up right here. That was great. Thank you for being my first guest.
Absolutely, I loved it. I had a grand time. Thank you for having me.
Well, again, thank you. I gotta get more people on. So, I mean, we're gonna okay. First of all, where can people find you? We're gonna do that. We're gonna start off.
You can find me on Instagram at 7marilosa, MARILOSA. Other than that, that's just it. That's all I have.
Boom. I created an Instagram. So I'm going to go ahead and put that link in the description, and you guys can go ahead and check everything out there. I will put this on the YouTube channel, get everything going. You're gonna have to get some people on, some doctors, nurses. I want to get doctors on.
I can talk to a few of my PAs that I'm still in contact with.
Nurses, EMTs, medics. I'm trying to get some of my fireman buddies on, but they're going through medic school, and they're just super busy. Sundays I've been trying to do, but it's like super people are busy
Absolutely.
on
I
Sundays.
could talk to some of my nurse girlfriends.
You know any firefighters?
No,
EMTs?
I don't. I might know a few.
Medics?
One, maybe. I can ask.
What about dental assistants? I know a few
Oh,
dental
I know
assistants.
a few.
Dental
I know
assistants.
a few of those.
Okay.
Mm-hmm.
Let's see. Surgeons?
I know one surgeon.
You know one surgeon?
Super busy, though.
Yeah, those are the type of people I want. I just want to, and then
I can help you out.
entrepreneurs,
I can definitely talk to a few people for you.
See, this is how it goes. Just network and build on from that. Yeah, I got a lot of people I'm going to get on. So, yes, she is a medical assistant, worked at urgent care. And this has been, my name is Xander. I am the host. And this has been the Ambitious Writers podcast. And thank you for tuning in. Yeah, peace out.
Bye.
Sweet.